The information found in this podcast is not a substitute for help from a licensed mental health professional. Hi, and welcome to the Women in Depth podcast. I'm your host, Dr. Lourdes Viado. Join me as we explore the inner lives of women, their struggles, fears, hopes, and dreams. We'll go beneath the surface and take a deeper look at what is hidden, unknown, uncertain, and uncomfortable. Hi, and welcome back to the podcast. Today, my guest is Alicia Taverner, and Alicia was on the podcast way back when I launched in July 2016. She was episode number 2, where we spoke about infidelity, and today I'm excited that she's back, and we're going to be talking about maternal mental health, basically mental health for moms. Alicia is a licensed marriage and family therapist with a private practice in Rancho Cucamonga, California, and she specializes in helping women find the calm within the storm of some of the most difficult relationship struggles, such as infidelity, divorce, and postpartum anxiety and depression. Alicia is also a trained Discernment Counselor, and she helps couples explore options for continuing the relationship despite some very heavy challenges. Alicia has contributed to several online and print magazines and podcasts, and has a regular spot on a local radio show as a relationship expert. Welcome back, Alicia.
Hi, Lourdes. It's so nice to be here again. I'm just amazed at how long this podcast has been going, and all of the content and all of the amazing guests that you've had. So yes, congratulations to you.
Thank you so much. I'm kind of amazed too that it's been this long, and there's been so many interviews, and it's just really full circle to think that you were a part of the beginning and helping this get launched. So thank you for that. And thank you for being back again.
Of course. Thank you for having me.
So you and I had started talking about another interview actually about a year ago. As we were talking about the experience of being moms and all the challenges that comes with. And we talked about having a conversation about this. And this is really a really good time to do this because May is Maternal Mental Health Month.
Yes.
So before we dive in, Alicia, can you share with our listeners why you are so passionate about maternal mental health?
Well, I think like most therapists, we all have our own journeys. And so after it's a little bit complicated because I have 3 children. The oldest she's turning 19 tomorrow. And then I have a 3-year-old and a 10-month-old. And so our older daughter came to us through foster care. And so I didn't go through the whole childbirth process and everything with her. But my first son, my first baby, who's technically my second child, after having him, I experienced postpartum anxiety and OCD. And I, being a mental health professional, thought, what is this? Like I've heard of postpartum depression. I had, learned about, I used to give classes, which is funny. I used to talk in a parenting group about postpartum depression. And so after having my son, I had a late onset. So it was about 6 months after having him that I started experiencing a lot of anxiety and a lot of intrusive thoughts, and just really fearful of things that were out of my control, which had never been me. And not knowing what it was because I had only heard of postpartum depression. And then actually, I think you have had Dr. Kat on your podcast.
Yes.
So she has her own podcast, which is Mom in Mind. And I remember when she launched her podcast and she told her story. And I can remember so vividly driving in my car and listening to her story. And I had to pull over because it was exactly what I was experiencing. And I just was in tears. And I picked up the phone after that and I called my husband and I said, I know what's going on now. It just gave me so many answers to what I was experiencing because it wasn't postpartum depression. I wasn't depressed. I could get out of bed. I could do all of the things that I needed to do, but I had all of these thoughts and this panic and this fear, especially when driving, which had never been an issue for me before. And so just learning about that and then finally getting the help that I needed, seeing a therapist and getting on medication was just really powerful for me and so, so helpful. And then so fast forward, I learned about what it was. I got help. I felt so much better. And then, I got pregnant again. And then, of course, my fear level skyrocketed. And I thought, oh my gosh, this is going to happen again. But I really took the steps to take care of myself after pregnant, or, throughout my pregnancy, but then really after, like having a plan and working with my doctor and psychiatrist to make sure that this didn't happen again. And so this time around, I felt like I could really enjoy this baby, even though the newborn stage is crazy. She's 10 months and I still haven't slept a full night.
But so sorry.
But it's been a completely different experience because I've taken care of myself mentally and I can experience the joy and all of the things that I missed out the first time. So a long answer to your question, but that's why this place of like perinatal mood and anxiety disorders, has a special place in my heart because of my own experience and not knowing what it was, even being in the field of mental health was really difficult for me.
And I think this is so important, Alicia, because I don't remember specifically what the statistics are. I know that Dr. Kat mentioned them when she was on the podcast before, but I know that perinatal mood disorders are actually more common than we realize.
Yes, it's 1 in 5. 1 in 5 women will experience a mood or anxiety disorder.
That's a lot.
Yes, it is actually the most common complication of pregnancy. And we normally think of like gestational diabetes, preterm labor, preeclampsia, those types of things as complications. But this is the number one complication of childbirth.
And I think too, beyond how it impacts, the mother, it also impacts her ability to bond with the baby, which affects that baby long term if the mother is unable to do what she needs to do because of what's getting in her way.
Right.
And I love how you describe that with support, with knowing what was going on, you were able to have a different experience this time around because you had tools, you had information, you had support.
Yes, it's been very different. And knowing what I know now, I can't go back, but I just thought, okay, now I have this child, this being that I birthed, and I'm responsible for him. So maybe that's why my anxiety is so high. I just thought, well, I guess that's just what comes along with motherhood, right? Like we change and we're not carefree anymore because I'm responsible for this life.
Yeah.
But it was off the charts anxiety, where I was almost like would have a panic attack driving and leaving him and, doing things that moms, we have to do. We take our kids to childcare, we do all of these things and go to work. And I just thought, why is everybody else okay with this? And I'm not.
I was looking at some numbers, before we talked today just to prepare. And I saw a statistic that from the Pew Research Center that in the United States for millennials, that there are over 16 million millennial moms. So if you take 1 in 5 and you extrapolate that, that is a lot of moms. If you do the math, which I'm not going to do because you don't want to hear me do math, but that's a lot of women who are affected by this.
Yes, it's so prevalent. But there's also all of these misconceptions and myths like, well, maybe when I go back to work, it'll go away. Or if I just spend more time with the baby, it'll go away. Or if I just get help, in terms of childcare, maybe if I have someone come in once a week and I get a break, it'll go away. So women tell themselves all of these things, these stories, because this isn't supposed to happen, right? Or this is supposed to be the most joyous time in our lives. But it's not. I mean, the reality is it's one of the most difficult times in life, and that's okay.
And I think, like you said, no one, we do a lot to help a mom and prepare for a baby, but there's no conversation about these types of experiences that she may have.
Hmm.
So I love that you're going into the myths of this. I'm just going to let you continue with what are, I guess, what are the ways that moms can get stuck in this kind of like a vicious loop of the perinatal mood disorder experience?
I think social media plays a huge role in this. And, we're all connected, by Facebook and Instagram and all of these things. And so I run a group for moms who are a little bit anxious and who want some tools and want support and being able to connect with one another. And it's an amazing group of women. But we talk a lot about what we see in the media, what we see on social media, because they perpetuate all of these myths. We see photos and pictures of maybe our friends who've had new babies. And I know I certainly wasn't posting all of my, bedhead and my, the pictures of myself where I just looked haggard and completely exhausted after I had my baby the first time. Now, the second time I've been way more authentic and way more real about the things that I post because I think it's really important, but I would see friends and I would, see their pictures. And I know a lot of my clients say, well, they make it look so easy, but who's really talking about that? We don't really have those conversations. And I remember sitting with friends and just thinking like, well, they got out of the house and it seemed easy for them. And then just talking with clients and they just have these unrealistic expectations of themselves.
It's almost as if moms don't talk about really how hard it is and how difficult it is. And it's almost taboo because this is, like you said, this is such a beautiful, joyous gift and moment, and just don't talk about it even with other moms, right?
Mm-hmm.
It's very, I mean, I guess occasionally here and there, but I would say even to the depths of how much, because you might say, I'm exhausted, I'm so stressed out, but that might be, as much as you might share even with a friend.
Yeah, I think that's the tip of the iceberg, but I think it's important to have like your true real friends that you can say like, this is really, really hard. And how did you do this? And for them to respond to you and say, oh, I cried every day,
Yeah.
To hear that. Well, of course we don't wish that on our friends, but I think it's so freeing and it's so amazing to connect and say, oh, okay, so this is normal.
Right. Yeah, all the things we don't talk about with motherhood. Like I was, one of the things that I was thinking about when you were speaking right now is, that I'm not really enjoying this.
Mm-hmm. Yeah.
And you feel awful to even think that. And then to say it out loud, it's just, I'll be a bad mom. Am I supposed to even have that kind of thought? I'm being selfish,
Mm-hmm. Exactly. And I think a lot of women, especially I hear from moms who have had difficulty conceiving in the first place. They go through fertility treatments and in vitro and all of this process just to have, they'll tell me this is what I wanted. I worked so hard to have this baby and then to feel a lack of connection or to feel like I'm not really enjoying this. I'm not supposed to say that.
Yeah, no, we don't talk about that it is going to be hard. You're not going to love it every second.
Mm-hmm.
You're not even going to like it every second, But yeah, I just think that these are, so important to talk about. And I can see how social media drives these mistaken beliefs of what motherhood is supposed to look like and feel like.
I think it's important to remember that we have to, these people on social media, they're sharing their best 20% of life, right? We don't see all of the challenges and the difficulties and if somebody's experiencing depression, well, they're not going to post a picture of themselves laying in bed, unable to get out, right? They're going to post a picture of that one moment where they got out of bed and their, kids were clean and smiling. And, how many pictures do we take to get the perfect picture? That's what people are posting. And we forget that.
And so what else has been, I guess, with the work that you're doing with moms, what are some of the other ideas, assumptions, or misconceptions that moms get stuck in or get lost in and then end up dealing with something more serious like a perinatal mood disorder?
Mm-hmm. I think getting caught up in the thought that they have to do it all. Nobody can do it like me. I work with moms who will be stay-at-home moms and they just feel completely overwhelmed with all of the house chores and taking kids to school and then dealing with a baby. And so we talk about like, well, what's realistic? Is it realistic to have your house be spotless every day?
Right.
Who's looking? And so I think that compiles, and they feel like they're not living up to the expectations, but it's whose expectations are they? So we really talk about like, where do those expectations come from? Where do we get these ideas that we internalize? And then kind of debunking some of those and working with reality. And it's okay not to have a completely spotless house every day. That's an unrealistic expectation. And what is it going to take for them to feel more comfortable? You know, do they need to hire somebody to help them in various ways? So we talk about like reaching out and asking for help in ways that they need, you know, hiring someone to clean their house, hiring a mother's helper, you know, who tends to the kids while you make dinner, or just simple tasks that we feel like we should be able to do all of these things. But that's the key word, is like should. Where do those shoulds come from? We talk a lot about that in my group.
Those beliefs, like you said, these mistaken beliefs or assumptions that we believe to be true, and then we structure our lives around this truth that we've never really looked at as what belief is guiding this, and where did it come from, and is it true?
Mm-hmm. Yeah.
Yeah. I see it very often too with moms that I've worked with, a sense that there are no options. Like there's nothing, I can't get more help because it'll be expensive. This is the schedule, you know, that we have to have because my husband works. And there's a sense of there is nothing they can do to change things. I don't know if you've seen a lot of that, Alicia.
Oh, definitely. I think moms kind of just fall into this routine sometimes, and they take it for face value without really exploring, you know, further options. And so having the support of the other women in the group is really powerful, sharing tips and tricks and, you know, all of the little things that they might not get. And so in the beginning, when I started this group, you know, I talk about like, we say that it takes a village, but then when you look around and you wonder, well, where is my village? So I've created this village for these moms, and it's so powerful to share those things because our society is different. You know, we come from a history of collectivism where people help you raise your children. And so we're so separate here in the United States. So it's difficult to ask for help.
Yeah, we get this tunnel vision, and then we're not able to see any other options. Like this is what I have to deal with. And yeah, then we get stuck on that. And I was reading when I was preparing for our conversation too, I saw something, I think it was moms in Japan have a lot of help, like in other cultures where it's not just the mom. And so the moms in other countries actually have reported feeling less stressed than moms in the United States.
I think it's Japan. I don't want to misquote, you know, I've read something like that too, but in one Asian country, I know they take a year to recover after childbirth.
I think it is Japan too. Again, I don't want to say it is, but I think it is also. But yeah, and also that after a mom gives birth, she gets like a whole month to recover, just to recover from giving birth.
We don't do that here.
Yeah, no. Even just with maternity leave, you know, I think the average is 6 weeks for moms to have a baby and be back at work,
which is insane.
And when I was looking at the statistics too, it showed that right now, more than any other time, there are more moms in the workforce also. So, you know, you have a mom who's working, and there was another research study done last year where working moms work 98 hours a week, or 2 full-time jobs per week is what a working mom is doing.
That's a lot.
Yeah. So Alicia, when you're working with these moms, what are some of the ways that you begin to help them to create or find or see the options or possibilities that they have, even if income is limited, support is limited? What do you do in that situation?
So a lot of what I teach moms is mindfulness techniques, being present, being in the moment, and really thinking about their thoughts. I know that might sound funny to some of the listeners, but thinking about your thoughts, you know, we have all of these thoughts that guide us, and kind of this, you know, this track that plays in our head where we tell ourselves what we should be doing. We might not be as kind to ourselves as we would hope, or as kind as we would be to a friend. And so we really start to kind of dissect their thinking patterns, their thought patterns. And I think that's so powerful because we can listen in on the shoulds and the, that little committee in our head that tells us that we're not doing enough, that it's not good enough. And then we talk about where that comes from. Once you're able to implement some of the mindfulness techniques and just letting them kind of wash away, like letting the thought come and go, it takes practice. And so we practice some of those things. And so they get good at it and they can recognize that this is a distorted pattern of thinking, or this is, I know where this comes from and I'm no longer going to be judgmental of myself.
Right. Because, what we think is the thoughts we have are so powerful and they affect the feelings that we have, and so it's really key to figure out what am I thinking and what's that making me feel. And if I can change the way I'm thinking, then how can I feel? But like you said, it's a practice and it's something that requires that continual, kind of refocusing yourself.
One of the most effective treatments for postpartum depression or anxiety is cognitive behavioral treatment. And so that's really what this is. And then, mindfulness is another kind of buzzword that's been in our culture for a little bit now. But I think coupling those two, it's really impactful. I've seen a lot of great results in the women that I see in my practice.
Yeah, because I think sometimes it's just difficult. You don't even, when you're in it, it's hard to see that you have these abilities to just maybe look at what you're thinking and think of it differently. But when you're in it, it's hard. So that's where, the support of other women, a group, a therapist is really helpful to kind of throw you a lifeline.
Yes.
Just so you know that you can get yourself out of this.
Mm-hmm. I think that's why therapy is so impactful and so effective, because you have this other person who's holding you accountable and saying, is that thought pattern, is that positive? Is that helpful for you? And where did you get that? And how can you change that?
What do you do, Alicia, when, you have a mom tell you that she can't help it? This is just what she does, that I react this way and I can't seem to get it under control. I don't feel like I can get a handle on this.
Well, I think part of what I do is really assessing for, life-threatening depression. When you talk about postpartum psychosis, I think that's something different. So just kind of assessing the severity of where a mom is in terms of her mood disorder. But then, if she says, this is just the way that I am, then we talk about, well, how that's serving her. If being this way makes you so uncomfortable, like, can you make some small changes? So starting really, really small with baby steps, and then getting them to see that, okay, this is having a positive impact. Just changing this one thought. And so it's not about changing your entire thought process. Of course, that's sometimes what moms want to do. We want to do it now and we want to hurry up and get there.
Yeah.
But just changing one thought, in this next week, or changing one pattern, changing something, very small, and then they start to see positive results. And then we talk about those results and, okay, well, now would you like to keep going? And then so we ask, do you want to keep going? It looks like you're making progress. Do you want to keep doing this because it seems to be serving you? And so they start to understand that those patterns are changeable.
And the thing too that's beautiful about mindfulness is once you figure out how to do it and you've done it a few times, you can actually begin to experience some pretty meaningful relief pretty quickly.
Mm-hmm. Yeah, I think so.
And I was also thinking too, how like today, I was just doing this, the chaos of a morning with children, right? and knowing I have to get to work, I have this podcast. I realized that my son was playing quietly, and I just sat down and I closed my eyes in a recliner, and I think I had like 2 minutes of that, but it was enough to kind of help me to reset. And I just like saw this opportunity of I'm going to sit down, I'm going to close my eyes, I'm going to breathe. And do this until I have to stop.
Yeah, just a quick little meditation. So I talk about meditation being so powerful. It's just like this little catnap for your brain, right?
Mm-hmm. Yeah. And, if you can find those moments, it may be 2 minutes here, 3 minutes there. It may be, in your car before you go in to pick your kids up, but you can find these moments and they do help, even though they're so small.
Yeah. I mean, we don't need a whole mindfulness retreat, right? For a whole weekend. Right. I mean, well, that's amazing. Most moms don't have that time, but just the small little moments make a big impact.
So with the moms that you've worked with, Alicia, what has surprised you most?
What surprises me the most when I put a group of moms together is their ability to connect. And I remember my first group, I had just these women from polar opposite ways of life, very religious versus very liberal, and just their lifestyles were completely different. And the connection that I saw was just amazing to me. It brought tears to my eyes when I recapped from the beginning to the end of this group, just because, I was apprehensive, to be honest, as a therapist, thinking like, oh, how are these women going to connect? Their lives are so different, but the things that we want and our feelings, they're so similar. And so, the relationships that the moms were able to make in this first group was just, it was so surprising, but just so wonderful. And, knowing that they stayed in contact even after our group ended and just, had this really, really full friendship where you can talk about, what's really going on, that we mentioned in the beginning of this conversation, having that person, having those people that you can really be honest with and say, yeah, I'm not enjoying this. How are you doing today? So just seeing those relationships was really amazing to me.
And so, Alicia, we had talked about you want to share this episode not only for maternal mental health, but also because of, Mother's Day. Mm-hmm. And so I wanted to ask you, what do you think are some good ideas for Mother's Day gifts? What do moms really want?
I think moms want to connect. We want to connect with our children, but we don't want all of the responsibility for a day. We want the good stuff, but, dad can take care of the tantrums and the dishes and all of the chores. But yeah, rest, relaxation. I think that's what moms want. So dads, if you're listening, breakfast in bed is amazing, but it's not if you have to clean up the kitchen afterwards, right?
Right. Yes. And I also, I was thinking about this. I was talking to another colleague that sometimes even the Mother's Day brunches aren't the greatest idea either, because being in a packed restaurant with all your children, sometimes
it's stressful.
It's not relaxing.
Uh-huh.
Yeah. Yeah. So really whatever you can do to help mom relax that day.
But I think moms sometimes feel guilty for asking for that.
I think in general, they feel guilty asking for anything. Almost, and when they do ask, there's almost a sense of, this is like tentativeness. Like, is it okay? Would you mind if you did this?
So I want to encourage moms to find their voice. It's okay to want a break. It's okay to say, I just need a breather.
Yeah. And that's perfect that you said that, Alicia, because last week we just released an episode with Melissa Thompson on new moms on finding and remembering their empowered, authentic voice, which, losing that or becoming disconnected from that happens quite easily in the course of motherhood.
It really does.
So, Alicia, where can listeners find you if they'd like to learn more about your work, get in touch with you, or see what other offerings you have?
So they can go to my website, which is ranchocounseling.com. They can also find me on Instagram. I am the handle Therapy with Alicia T, and on Facebook at Rancho Counseling. And this month I'm doing a Minute for Mama, short little videos where I educate women about perinatal mood and anxiety disorders, ways that they can implement mindfulness and other techniques into their life. And I'm sharing all my fun photos of real motherhood. So if you want to see what I look like after not sleeping for 3 days, or, various things that kind of debunk all of those social media myths and things that we see, I'm sharing all of that on Instagram and Facebook this month. So I hope you'll join me.
I love that Minute for Mama. What a great idea, Alicia.
Oh, thank you.
It's wonderful.
It's been really fun making these videos and being able to share because, as moms, we have a minute.
That's it.
We have a minute. Tell me what I can learn in a minute.
Yeah.
And so I'm posting videos every day this month about, like I said, perinatal mood and anxiety disorders.
And we'll put a link to the show notes, Alicia, so that listeners can find you and get in touch with you.
Great.
Thank you so much for coming back on today and having this conversation. So important. Thank you for the really wonderful and important work that you're doing for moms and families.
Thank you. And thank you for all of this hard work that you've put into this podcast. I know that your listeners value it so much.
Thank you, Alicia. Bye-bye.
Bye.
Thanks so much for listening to the Women in Depth podcast. I hope it brings you a deeper understanding of yourself and others, and that you found some insights that illuminated and inspired. You can follow Women in Depth on Facebook and YouTube, and if you haven't yet, please subscribe on iTunes and leave a review. And finally, if you enjoy Women in Depth, please share with a friend. Again, thank you so much for listening, and see you next time.